loss of appetite or feeling very full after a small meal, pain in the abdomen, swelling or fluid buildup in the abdomen, unexplainable weight loss. Did you know these are symptoms of primary liver cancer? My name is Doctor.Global. Let's discuss this disease in more detail. Primary liver cancer overview. Primary liver cancer develops from liver cells, whereas metastatic liver cancer starts in another organ and spreads to the liver. Liver cancer represents the sixth most common cancer worldwide. Annually, about 900,000 people are diagnosed with primary liver cancer worldwide. The median age for liver cancer diagnosis is between 50 to 60, but in Asia and Africa, it tends to be earlier, between 40 and 50. The disease is more prevalent in Southeast Asia and Western Africa, largely due to the higher rates of hepatitis B infection. Let's consider the classifications. Primary liver cancers can be classified according to the type of cell they start from as hepatocellular carcinoma, the most common, aggressive liver cancer making up 73% of cases. It starts in hepatocytes, the liver's main cells, and grows invasively. Cholangiocarcinoma, a bile duct cancer, takes about 18% of the primary liver cancers. It develops in a bile duct, a thin tube connecting the liver to the small intestine. Angiosarcoma, representing only 1% of primary liver cancers, originates from the liver's blood vessels and grows quickly. What are the causes and risk factors for primary liver cancer? In most patients, primary liver cancers are preceded by cirrhosis of the liver. In cirrhosis, liver tissue is slowly modified at the expense of normal liver cells and consists more and more of fibrous tissue and scar tissue. In this case, the liver cells do not grow or function normally. The main risk factors of primary liver cancer are the ones causing cirrhosis, such as chronic hepatitis B and C infection significantly increase liver cancer risk, especially if they persist over 6 months. Long-term alcohol abuse causes irreversible damage to the liver cells. Smoking. Chemicals in tobacco smoke can cause genetic mutations that lead to cancer. Severe obesity and diabetes mellitus are associated with non-alcoholic steatohepatitis. Inflammatory conditions such as autoimmune hepatitis and intrahepatic primary inflammation, and inherited liver conditions, including hemochromatosis and alpha-1 antitrypsin deficiency. Other risk factors not related to cirrhosis are gender. Liver cancer is 4 to 8 times more common in men than in women. Exposure to toxic agents such as anabolic steroids or aflatoxin-contaminated food. Well, let's move on to one of the important parts of my lecture, the symptoms. The main symptoms that could be related to liver cancer are unexplainable weight loss, fatigue, loss of appetite or feeling very full after a small meal, nausea or vomiting, swelling or fluid buildup in the abdomen, jaundice, pain in the abdomen, itching, caput medusae, which means the network of large, visible veins around the abdomen, enlarged spleen. Diagnosis. Methods for diagnosing liver cancer include clinical examinations. Doctors check for any changes in the size, shape, or feel of the liver or spleen. Blood tests used to assess liver damage include hepatitis testing, iron level measurement, evaluation of aminotransferases such as ALT and AST, and the alpha-fetoprotein test. Upper endoscopy allows for the checking of vein dilation in the esophagus due to liver cirrhosis or another form of liver disease. A liver ultrasound is done to evaluate the consistency of the organ and to look for possible nodules. CT or MRI scans of the abdomen are performed to evaluate the local extent of the tumor and whether it has spread to other organs. To get a more precise image, a computed tomography or magnetic resonance imaging scan with intravenous contrast liquid might also be performed. A tumor biopsy is done with a fine needle that goes through the skin of the right flank. This procedure helps to investigate the source of the tumor. Treatment. Liver cancer treatment can vary based on the stage of the disease, the health of the liver, and overall patient health, but typically includes the following options. Surgery. Partial hepatectomy can only be performed in patients without cirrhosis or with limited cirrhosis, since the liver still functions correctly. The remaining part of the liver will take over its function. Liver cancer is treated in hundreds of clinics worldwide, using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures such as major liver resection or hepatectomy or chemoembolization can cost twice as much in Turkey and Thailand as in Vietnam and Brazil, but half as much as in Ireland and Finland. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click your request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Let's return to the treatment methods. Liver transplant replaces the diseased liver with a healthy one from a donor. It is often done in cases where the cancer has not spread outside the liver. Local methods. Radiofrequency ablation uses heat to destroy cancer cells. Percutaneous ethanol injection uses ethanol to scorch the tumor. The ethanol is injected directly into the tumor through the skin. Transarterial chemoembolization delivers chemotherapy directly to the liver and blocks the artery to cut off the tumor's blood supply. Radioembolization utilizes radioactive substances like iodine-131 or yttrium-90 to block blood supply to the tumor. Radiation therapy targets cancer cells with high-energy rays to destroy them, more commonly used when surgery is not an option. Targeted therapy with sorafenib, which blocks tumor growth, is used in case of cancer progression despite transarterial chemoembolization treatment. Immunotherapy boosts the immune system to better recognize and fight cancer. Chemotherapy shows an oncostatic impact, meaning it blocks the tumor progression but does not eliminate the existing lesions. Treatment protocol for patients with advanced liver cancer is symptomatic to control pain and nausea and prevent rapid inner intoxication. Prognosis. According to the American Cancer Society, the 5-year relative survival rate for early liver cancer is 37%. For intermediate advanced cancer, it is 14%, and for terminal HCC, it is 4%. Regardless of the stage, the survival rates are higher for surgically resectable cases. For people with early-stage liver cancers who have a liver transplant, the 5-year survival rate is in the range of 60% to 70%. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.